We're so close to achieving HIV epidemic control. It's really exciting, but I'm a little worried.
Why?
Well, how are we going to maintain all the health workers needed to support epidemic control for the long term?
True. Donor support for different cadres of health workers has helped scale up HIV services. But now we need to think about sustainability. Governments won't be able to absorb all these workers into the public sector.
What can we do?
What about the private sector?
The private sector? The private sector is too small to be able to employ more health workers to scale up HIV services to the level we need.
Actually, a study done recently in South Africa and India looked at the private sector's health workforce. Did you know that in South Africa, almost 40% of the population is accessing care in the private sector? And in India, the private sector employs 70% of the health workforce. There are a lot of opportunities to consider.
Like what?
Well, the private sector serves people from every income quintile. Many even focus on the very poorest in rural areas.
Interesting. I thought the private sector was just out to make a profit. How are they making it affordable?
Organizations are innovating in the types of health workers employed in technology to keep costs low. One in India, Global Healthcare, provides affordable, high-quality services in very remote areas through digital kiosks that are staffed by one nurse, supported by artificial intelligence, and telehealth consultations with a remote doctor.
But the private sector still mainly serves the rich, right? That's not a good fit for HIV.
Actually, in many countries like Tanzania and Kenya, HIV prevalence in urban areas is highest in the top 2 income tiers. These higher income clients don't really need the subsidies they've been receiving for HIV services. In South Africa, the study found the private sector already employing health workers to deliver differentiated care for HIV services to cater to higher income clients. For example, the retail pharmacy chain Clicks is conducting a national health insurance pilot where some stores serve as convenient ARV pickup points.
I've heard the quality of private sector services can be pretty bad, though.
Quality is important for the private sector. Their survival is based on patients coming back because they like the care they receive. The private sector uses technology, data, and oversight to ensure quality of the services their employees provide.
Okay, so what kind of HIV services can health workers in the private sector provide?
The private sector can support service delivery across the HIV clinical cascade. For example, look at the first 95 target, knowing HIV status. Did you know that the private sector employs a large number of community health workers?
Really?
In South Africa, Expectra Health Solution works in one of the poorest districts with community health workers, doing door-to-door patient profiling and medical interventions. There's a lot of organizations that can do HIV testing with the workforce they already have.
Sounds promising. What about the second 95 target of ART?
The private sector can expand affordable access to ART. The Unjani Clinic Network in South Africa is a network of nurse-owned and operated primary healthcare clinics. The nurses are trained in nurse-initiated and managed ART and provide services across the HIV clinical cascade. Also in South Africa, the company CareWorks contracts with employers and uses community health workers and peer educators to deliver ARVs to company employees.
What about the third 95 goal of viral load suppression?
Private sector laboratories can help expand access to viral load processing. Health management companies can support private doctors and nurses to take on HIV services. And community health workers can follow up with patients to ensure adherence. Networks like the Asian Health Alliance in India give access to low-cost diagnostic centers in urban and rural areas and could be expanded to provide viral load processing. And the private sector's community health workers can help with follow-up. CareWorks has adherence rates of 92% thanks to counselors that stay in regular touch with patients.
Sounds amazing, but I don't see the private sector working in HIV very often.
Yeah, in some countries the private sector isn't doing anything for HIV because government policies and subsidies make no room for them. Donors in the public sector have a real role to play in including the private sector in the HIV response and as key stakeholders in overcoming health worker obstacles. First, the private sector won't enter in unless they see a market opportunity, like high demand or low barriers to entry. Targeting subsidies in the public sector to only those who need them can make room for the private sector to focus on people with the ability to pay. Policies like tax breaks can help incentivize the private sector to enter, making it easier to access the resources they would need, like ARVs and loans, also help make it feasible. As these market opportunities grow, private sector will look to hire and retain more health workers to deliver the needed services. Second, because the private sector is so diverse, they can be used as employers of health workers to get to clients that are hard to reach through the public sector, or to better serve existing clients. It's important to engage with the private sector on HIV challenges to find more innovative approaches. Third, the government needs to be judicious about regulation. Regulations can allow innovative and flexible business practices and assure quality. But too many regulations of all kinds may discourage private sector growth and health worker employment. And lastly, we need to determine how to pay for their services. The private sector can innovate in employing health workers in technology, or they can leverage public-private contracts to build targeted, differentiated care models. They can be included in national health insurance schemes too.
Wow, it sounds like there's a lot we could be doing with the private sector's health workforce.
Yes, we should definitely engage the private sector now, so that we can ensure that the workforce created for epidemic control is here to stay.